Facial contouring with neurotoxins and fillers can feminize the face. As we said, neurotoxins will relax these muscles. In the forehead, these are the muscles that make us look older, more tired, or worried. We can also relax the crow's feet at the sides of the eyes. I think they're sort of laugh lines. I kind of like them, but many people don't. And so it's possible to relax those using a neurotoxin. The masseter muscles can be felt as we clench our teeth. So if you do this to yourself, just bite down hard. That's going to make this muscle feel more firm. And it also makes the jaw appear broader or more masculine. So relaxing the masseter muscles with neurotoxins can soften a strong appearing jaw. Now, here are examples of facial fillers, okay? Now, facial fillers come in pre-filled syringes, and oftentimes they're sort of cut with lidocaine to make this less uncomfortable. So here's a patient that actually this is made from a photograph that I took of me injecting one of my clients. This patient is relatively comfortable as the filler is injected the zygoma, this portion of the facial bones. Facial fillers are often made of hyaluronic acid, which we make in our skin anyway. But facial fillers will come in pre-filled syringes and oftentimes with a pain-relieving substance like lidocaine. In this picture, we can see that I'm actually injecting my client here. This diagram was actually made from a photograph. And what I'm doing is I'm injecting into the skin over her zygoma here in her face. Now, as I'm doing that, she can hear the sounds of my syringe just against her bone, but controlled breathing and nitrous oxide and the little bit of xylocaine that's already in the syringe can help a lot. But what we're trying to do there is actually lift up this area so that these more saggy areas will become less noticeable. So here is how, in this patient, the filler would raise the appearance of the cheekbones. You can see a difference from left to right. In addition to lifting the cheekbones, fillers can do other things as well. As I mentioned, a filler up in the cheek area can reduce the nasolabial fold and can reduce the prominence of the marionette line. Now, what could possibly go wrong here? These products and procedures do have risks, and if anybody tells you they don't, just go away, find a different provider. While temporary, first of all, you might not like the results. You may just not like the way it looks. A neurotoxin can temporarily drop a brow. So for example, if somebody would place a bit of Botox here, for example, and relax the brow, it may create an asymmetrical look. I'm glad I can demonstrate all of this on my own face. A person can be allergic to the product. Neurotoxins can migrate, and sometimes people will have difficulty swallowing after they have had injections with neurotoxin. And that difficulty in swallowing can actually last for several months. That's not a good thing. The worst thing that can happen is that an injector can inadvertently block the flow of facial blood vessels, and this can lead to permanent loss of sight, can you imagine, and certainly injury to the tissues that are involved. I'm not saying this to scare anybody, but I think it's always important to remember that all medical procedures and all medications do have risks and potential side effects. If you're going to a provider who tells you that there aren't risks, you need to find a different provider, in my opinion. In any event, I hope this information is helpful to you. If it is, please like this video and send it to somebody else who might be interested in the information as well. You know, I think a lot of these products are sort of aimed at trying to make people look younger and more energetic, but they can be selectively used to help people achieve their desired gender-affirming appearance as well. In any event, thank you for watching, and I'll see you in the next video.